Hello, in this video we are going to learn how to care for a patient with tracheostomy at home. The materials we need before starting tracheostomy care are hand sanitizer, mask, 2 bowls filled with sterile water, 5 to 6 pieces of gauze, rope to tie around the neck, sterile gloves, scissors, T-piece, suction catheter, bowl for discarding used items, suction apparatus with suction tube. Before we begin care, ensure the patient's head is elevated at 45 degrees. Explain to the patient about the procedure. Perform hand hygiene before touching the patient. Put on your mask and clean gloves. Make sure all items needed are kept ready at bedside. Do not place anything on the patient's bed. Turn on the suction apparatus, attach the T-piece to the suction tube and make sure the suction pressure is set between 100 and 120 mmHg. Remove the old gauze placed on the tracheostomy tube. Remove the inner cannula gently and place it in the bowl filled with sterile water. Discard gloves in the discarding bin. Repeat hand hygiene and wear sterile glove. Consider your dominant hand is sterile and other hand is clean. Attach the suction catheter to the T-piece and hold it like holding a pencil. While inserting the suction catheter, do not close the T-piece. Insert around 10 to 12 centimeters, then close the T-piece with the thumb of clean hand. In a rotatory manner, remove the suction catheter gently and slowly within 15 seconds. Rinse the catheter in sterile water. Repeat the same until the secretions are clear. Do not repeat the suction procedure more than 3 times. Turn off suction apparatus. Disconnect the suction catheter from the T-piece and discard with gloves. For stroma care and tie changing, prepare the following. Take a square piece of fresh gauze and make a slit at the center using scissors. Measure the rope around your elbow and cut the same. Prepare 2 such pieces. Perform hand hygiene and wear clean gloves. Remove the old dressing carefully. Take a gauze piece and soak it in sterile water and squeeze out the excess water. In a rotatory manner, clean around the stoma. Make sure while cleaning, the tracheostomy tube remains secure by a helper. Fold the rope with one hand short and other long. Carefully thread the folded rope through loop in the side of the tracheostomy plate. Secure it with a knot. Repeat the same with another rope from the other side. Take the long end of the rope from one side around the back of the neck to tie with the short end of the other rope. Repeat the same for the other side. Make sure there is a finger gap between the tie and neck of the patient. Take the slit gauze and place it around the stoma from below the tracheostomy tube. Clean the inner cannula with thread-like gauze piece rinsed in sterile water. Make sure the inner cannula is completely clean. Insert the inner cannula in the tracheostomy tube gently and carefully. Take a new piece of gauze and soak it in sterile water and rinse out the excess water. Open the gauze and fold it into 2 layers and place it over the tracheostomy tube and secure it by inserting it into the sides of the rope. The tracheostomy care is thus completed.